So normally Gill and I work in the community supporting the more complex stroke patients with their ongoing rehab, which may continue for many months and sometimes years.
So how has this changed in the current situation? Well, we've been redeployed to work in a different area from normal in order to support stroke patients recently discharged from hospital, to try and free up the hospital beds and get people home as soon as possible. Patients that haven't seen any visitors or family or friends for weeks due to visiting restrictions, and many of the patients have had COVID themselves, which may have impacted on their inpatient rehab. Wearing PPE for all our visits has now become the norm and requires in itself a certain degree of preparation to ensure that we arrive at the patient's house armed with all the right gear. Once inside, there's also a certain amount of care needed. Dogs are particularly fond of ripping aprons, jumping up, so we've also become expert dog whisperers. Our colleagues who are having to work from home are keeping in touch with our longer term patients and ensuring adherence to exercise programmes, so that when issues arise we are also having to go out and review these patients to try and resolve some of their problems. People continue to have strokes, and rehab is essential to maximise recovery and restore as much independence as possible, especially important in the early weeks following discharge from hospital, when there are lots of fears and anxieties. Patient gratitude is phenomenal at this time, and that's what spurs us on every day and makes this so much easier to cope with. So to all the stroke survivors, keep working, keep exercising, and we'll get through it together.